Well, today on the show, we're at the office of Dr. Michael Diaz on Tommy Monroe Drive here in Biloxi. Of course, well-known plastic surgeon, reconstructive surgeon here on the Gulf Coast. How are you? It's good to see you again.
Thank you for coming.
Well, thank you very much for having me again. If you would, before we get into some of the procedures and everything, tell us a little bit about yourself.
Yeah, I'm a board-certified general surgeon as well as a board-certified plastic surgeon. I did all my training over in New Orleans at Louisiana State University. Mm-hmm. And I've been here in practice in Biloxi for about 10 years now.
Yeah. Now, we have visited you on occasions in the past talking about some of the different things that you do, whether it's invasive, whether it's non-invasive. You do a lot of the invasive things, so to speak. One thing that you do from time to time are facelifts, which is, and again, it's going to be different with every other person.
That's right. One of the things about plastic surgery is that we really classify ourselves as innovators, and we are constantly pressing the envelope of coming up with new techniques and new procedures. And one of the things that we really have come to understand here in the last 10 years is you really want more of a natural, rejuvenated look. Mm-hmm. Everyone knows that we've seen pictures of actors, etc., that they really look plastic.
Well, I could go down to a list right now.
That's right. And
sorry, Kenny Rogers. I mean, I'm sorry. Did I drop a name? Go ahead.
but we really try to not do this, and we do it by a lot of new procedures that we really understand the facial aging where patients lose volume, they lose their fat cells over time. So it's not just pulling the skin tight. It's also restoring volume, putting the volume back where it was, and then redraping the skin over. And I'm really concentrating on facial aesthetics. But you can take that same concept with fat volume and fat transfer into, I know a lot of people have heard about the Brazilian butt lifts. And that's just taking fat from places in your body where you don't want it and placing it to places in your body where you do want it. So we take pride in what we do here. We are cutting edge. We do.
Now you have a board certified operating room?
Yeah, we have our own operating room here in the facility, which gives the patients a very private, personalized experience that can't be measured by anyone else. This is something that we do here, and we take pride. And we are a Quad ASF certified facility, which is the highest accreditation you can get from a single standing surgical center. And we take pride in that. Our staff that we have here is first class. So the moment a patient walks into this facility to the moment the patient walks out of the facility, and then all through the post-operative time period, is going to be first class. And that's one thing that we always strive on.
Now let's talk about some of the other things that besides the facelifts. I mean, you really go to an extreme with that. I mean, as far as washing their hair, it's almost like you're coming to a beauty shop. And you're going to get a real makeover.
Well, like I said, it goes back on to giving that patient the first class service. And we want them to know that no stone has been left unturned. Where when they leave here on their post-operative visits, we have taken care of them fully, not just from an operative standpoint, but we take into consideration their needs. A patient after an operation, especially a facelift or a blepharoplasty, which is an eye surgery, their hair's messed up and they have blood in their hair. So we want to make them go home comfortable. So we offer all these services that can help make their overall experience.
Well, I know of several people that have used you for different services, and I have heard nothing but rave reviews. Of course, I have too. The little Kybella thing that I had done, that I'm very happy about. So, and there are other things that you do as well.
Well, and you're exactly right. So it's not only an operative experience, which we offer here and we're very proud of, but we have a whole armamentarium of non-invasive procedures. So when a patient does come and visit us, that we can offer them everything that in 2017 is within the standard of care when it comes to plastic surgery, which basically puts us in a different position because we can offer non-invasive procedures. However, if they want a different result, a longer lasting result, we can offer invasive procedures.
Let's talk about this new reconstructive surgery that you do for breast cancer patients.
Yes, we do offer what it's called a DIEP flap, and it's a perforator flap, and we are the only place on the entire state of Mississippi that offers it here in Biloxi, Mississippi. We do it over at Garden Park Medical Center and at Biloxi Regional Merit Health. And what this is, it's state of the art. It's using your own tissue basically from your stomach.
Kind of like the Brazilian butt thing.
That's right. You take tissue where you do not want it and you put it where you do want it. So it's patients who have had breast cancer, they've had their mastectomies, their breasts have been removed. So we recreate their breasts with their own tissue where they don't want it. So they get a tummy tuck out of it. So it's
now, do you do that in conjunction with an implant, or can you do it just on its own? Or?
Well, and that's the advantage. You don't even have to use an implant. So that patient who doesn't want any foreign body in their body, they can use their own tissue. So it's 100% autologous, which is using their own tissue. However, if a patient down the road wants to be slightly bigger, you can add an implant as well. But it works really, really well in patients who have had radiation where implants do not work.
Right.
So that's the advantage of it. And in the past, this procedure did have to take the muscles on your stomach to have the tissue survive. Now it's all microsurgery. It's done under a microscope, and you can leave the muscle intact. So you're not robbing Peter to pay Paul.
Well, that's amazing. And as you said, technology has come so long. I mean, everybody is looking for that fountain of youth. Well, it's not in a magic pill or something you can drink. I mean, you have to go to that point where you do have to have some type of surgery. And staying on top of that surgery, you know, I hate to use this term, the cutting edge of technology to where to give them that natural look.
Well, you're exactly right. We strive for staying very current, and we want to give the overall look very natural, to where the patients, when they are in an operating or when they see their friends that they haven't seen in a while, they're going to say, "Hey, look, you look great." They're not going to say, "Who did your operation?" And that's the key.
They all say, "You look strange."
we want to keep it very natural.
Yeah.
And basically wind back the clock for all these people 10, 15 years.
Dr. Michael Diaz, thank you so much for your time. If
Thank
you'd like
you.
some more information on any of these surgeries, the number's on your screen. Go to the website, give them a call.